D does have some anti-cancer properties in high doses. It does help to make the cancer cells behave more like healthy cells, which is a process called differentiation, and that has been well published. So we combined a bit of vitamin D, started him on LDN, and in a few months his tumor, which was about 1.5 inches, actually disappeared completely. And he had a new scan done at about 2 years. He didn't even communicate with me during this time. He just, all of a sudden, he sends me a scan 2 years later and says, hey, look, it's all gone. It was amazing.
Wow.
So we followed him for a while, and at about, I think about the 4-year mark, we decided to publish his case. And he's now over 5 years. Still, there's no evidence of cancer. He's living a normal life. He's very healthy, and he is continuing to take the LDN, or low-dose naltrexone, and he's continuing to take his vitamin D, and those are the only cancer treatments that he has taken since we met him 5 years ago.
So, low-dose naltrexone and vitamin D3.
He was told by the idiot doctor that because he had a tumor in his throat area, they have to take out his tongue, take out his voice box. He wouldn't be able to eat normally, speak, and plus they'd have to zap him with chemo and radiations. He'd have a terrible quality of life, terrible ordeals, terrible quality of life for the rest of his life. But he instead cured it with LDN and vitamin D.
Any history in the family of cancer?
No, he didn't have any family history, but he did smoke in the past, so I think that was probably a risk, and then he did drink a fair bit of alcohol as well.
Wow. So, my guest today is Dr. Akbar Khan. Dr. Khan is the medical director of Medicor Cancer Centers in Toronto, Canada. And, for the last, it's hard to believe these, I'm reading this stuff about you, Akbar. For the last 21 years, his primary practice has consisted of providing personalized care by focusing on a limited number of cancer patients. Now, what's hard to believe about this is that you've been practicing for 21 years.
I can't believe it myself.
You look like you're about 19 years old.
I don't feel that old. It's been a while.
I know. I say you look like a kid. You look like you're about 19, 20 years old, and it's very intimidating to an old man like myself. But you do some incredible work with the low-dose naltrexone. Have you had other cancer patients besides the one you published?
Well, we've had many patients, but first of all, I can't necessarily take credit for our work and our findings. I really have to credit the patients because they're the ones that really helped educate me on the use of these medicines. The listenership has to understand that in conventional medicine, I trained at University of Toronto, which is one of the top universities in the world for medical school. They don't teach us this kind of stuff. This is an off-label use of a drug. This drug is not approved for cancer treatment, and it's really the patients and advocacy groups like these.
You should sue your school for not teaching you anything useful.
So I have to credit them. I cannot really take the credit for it.
And that's very, very honorable, and you are an extremely humble man. But bottom line, if it wasn't researchers and people who put themselves out there and had the interest like yourselves, none of these other groups could thrive, and none of these other groups could do their work. So I have tremendous admiration for you and tremendous respect for you.
Well, thank you.
You're welcome. My guest today is Dr. Akbar Khan from Toronto, Canada. He is a physician who works in integrative medicine, for lack of a better description, does a lot of cancer work. We're live in the air taking your calls at 847-956-5042. That's 847-956-5042 is.
Sure, yeah. So DCA is short for dichloroacetate, which the full name is sodium dichloroacetate. That is another medication like the LDN, which is not really approved as a cancer treatment. It's approved for a rare genetic disease called lactic acidosis, which in fact is quite rare. That I've never even seen a case of that in my entire career. But this DCA does have lab evidence and human evidence that it works as a cancer treatment.
Now, lactic acidosis, isn't that something you more see with excessive exertion?
Yeah, it's the same kind of thing. You build up lactic acid in the blood, but in this case, it's a genetic disease where there's a defect in the gene that causes acid to be built up even when you're not exercising.
Okay. And the dichloroacetate, the DCA, is this something that's readily available?
Well, it's not readily available, so you would have to go to a compounding pharmacist to obtain it, somebody such as yourself. It has to be a custom order and custom produced for each patient.
Okay. To be honest, I've never, other than the literature you've sent me, I've never come across DCA in the past. So it was when we were talking about that about a month or so ago, really caught my interest. As many of our listeners know, my 10-year-old rescue dog, Duncan, developed inoperable lung cancer back in May. That's what it was diagnosed. He didn't contract it then, but it was diagnosed back in May. So it's been about 2 months, and he was given about 3 days to survive. And we've had him on low-dose naltrexone, 4.5 milligrams once a day, since he had the diagnosis. And he's doing reasonably well. But you had sent me a note about DCA and using it with the dog as well. So, what kind of dosing on something like this do we work with him? Is it big doses, is it small doses? Is it weight determined? Is there a steady dose for every patient? How do you, because with low-dose naltrexone, it's pretty straightforward. Right. 4.5 milligrams is pretty much the standard dose.
Yeah, so low-dose naltrexone is pretty easy, and that's pretty much the same dose that we've used for all our patients. And as you asked before, we actually have many patients, not just this guy with the tongue cancer. He's not just like a 1 in a million case. We have dozens of patients that have done well with low-dose naltrexone. But the dosing for that is pretty standard. It's in the range of 3 to 4.5 milligrams once a day at bedtime, whereas the DCA, the dosing for that is calculated on a body weight basis. It's an estimate. We start with a dose of roughly 20 to 25 milligrams per kilogram of body weight per day, and that's divided up into 2 or 3 doses.
So it's a pretty substantial dose.
Yeah, that's a much higher dose than a low-dose naltrexone. So this is now this drug is a little bit more powerful than the LDN, we find, in terms of its ability to treat cancer, but it also does have some side effects as compared to the LDN, which has really almost no side effects.
Now, you've used it for prostate, colon, ovarian, neuroblastoma, lung carcinoma, cervical, endometrial. I'm going to destroy this word. Cholangiocarcinoma, sarcoma, and T-cell lymphoma cancers is what I'm reading with from one of the articles from the website.
Yes. So DCA as well as LDN, we would consider both of these to be broad-spectrum cancer treatments. In other words, they work on a whole range of cancers. In fact, I don't think there's any one particular cancer type where I would say it does not respond to DCA. There's individual variation. In other words, every patient doesn't respond, but there's no one cancer type where you would say doesn't respond. It works for every cancer type.
Do you ever use the 2 drugs together?
You can. I haven't historically. A couple of times I have done that, and out of patient request, and we have seen good results. We had one patient with pancreatic cancer who I've lost touch with, but she did very well with a combination of DCA and LDN, and she had really pancreatic, as you know, it's an extremely aggressive and rapidly fatal cancer, and she did well for at least 6 months while I was still in contact with her, and the cancer actually shrank on the scan, and she was not taking any chemo at the same time.
That's pretty incredible.
Yeah.
Well, my guest today is Dr. Akbar Khan. We're talking about cancer treatments. We're talking about integrated.
Might help control the sugar better.
Right. It gets rid of a lot of the compulsions with eating. I think that was the indirect effect with the LDN and the weight. Dr. Andre Lev Weisberg in Glenview has done quite a bit of work with patients with that in that respect. So. Oh,
okay. I'm sorry. And who's that doctor in Glenview? Doctor, did you say?
Andre, and the last name is a hyphenated name, Levweisberg, if I'm not mistaken on the spelling. But if you get a hold of us at Mark Drugs in Roselle, we can give you Dr. Lev Weisberg's telephone number, Mary.
Yeah, great.
And okay, let me give you the telephone number for the pharmacy. It's 630-529-3400.
Yeah, in fact, I got to call you guys anyways to get a refill on some of my prescriptions, so that'll work out great. Thank you both very much. I'll share this with the people that I know. Oh,
you're welcome, Mary. Bye-bye now. Thanks for calling. Again, we're live in the air at 847-956-5042. That's 847-956-5042. My guest today is Dr. Akbar Khan. Although he is a specialist, would you call yourself a specialist in integrative medicine cancer treatment, doctor?
Well, you could say that. My training is family medicine. I'm not an oncologist, but I do subspecialize, if you want to call it that, in cancer treatment, and now we're doing even more cancer prevention as well.
It's interesting because I don't think that there are a lot of people who go into specialties like oncology, for example, who are willing to look outside of outside of the golden rule norms.
I think you're absolutely right, and that is a big problem because they're really missing out on a lot of opportunities for their patients with these gentler treatments that are non-toxic And, we hear all the time from the patient, it's like the treatment's worse than the disease when it comes to advanced cancer. And that really doesn't have to be the way, that's not the way it should be. We should be looking for gentler alternatives.
Well, the patient you described, that you wrote your paper about a couple of years ago, who had the tongue cancer, is a perfect example. He had a 1.5-inch tumor in his tongue, and they could remove the tongue, they could remove the lymph nodes, they could remove a portion of the larynx. So he wouldn't be able to eat, wouldn't be able to talk, basically wouldn't be able to do anything that he had done for the previous 55 years of his life. And, you gave him that beautiful opportunity to live life.
Oh, he's so happy. And not only that, when we were publishing his case, I sent him the paper just to review and make sure all the facts are correct. And he actually got mad at me because I didn't have his name in the publication. And I said, look, normally we don't put patients' names in publications. It's anonymous. But he insisted. And in fact, we got permission from the journal, and he signed a document to confirm that this was his wish. And his name is actually in the article itself, as well as his email. So other patients can contact him and, kind of get more information about LDN and gentler cancer therapy.
And that's one of the things about LDN that I've been so enthralled at. It's a worldwide community.
Absolutely.
I mean, you take someone like Linda Elsgood, who you and I are both very familiar with, who is the driving force between the LDN Research Trust and, she herself has multiple sclerosis, and LDN changed her life, and her motivation is not money. Her motivation, in fact, it costs her time, costs her personal funds. Her motivation is getting the word out to help others around the world, to create awareness about the opportunities for people to benefit from low-dose naltrexone. It's really amazing.
Yeah, absolutely. And low-dose naltrexone, it's not a profitable therapy. The drug itself is very cheap. Nobody really makes any money off it. Even in our clinic, we do sell it as well, but we're not allowed to make a profit because of the local laws. So it's really a service to the patient. We're really just trying to help to change the face of cancer therapy.
And, at Mark Drugs in Roselle and Deerfield, we compound low-dose naltrexone. And the typical cost for a patient is anywhere from $18 to $25, $27 a month, depending on dose and quantity and frequency. But it's not a lot of money.
It's not a lot, exactly.
No, I mean, it's the equivalent of a couple of Starbucks a month.
That's right.
So, you ready to go back to the phones, Dr. Khan?
Sure.
Again, we're live in the air taking your calls at 847-956-5042. That's 847-956-5042. Good morning, Joanne in Schaumburg. Welcome to Doctor and the Pharmacist. How can we help you today?
Good morning. It is a natural product called acetyl L-carnitine, which I believe Dr. Mark must have in his store. And the other one is called alpha-lipoic acid.
And high-dose B vitamins for neuropathy.
Powerful effects to help heal neuropathy.
Well, one vitamin I've been taking that another doctor had been talking about on the radio is benfotiamine.
Yeah, benfotiamine is a high-potency vitamin B1. That's excellent.
But I'm not taking the complex. I'm taking that with B6 and B12.
So that's very good. But you should also look at adding lipoic acid if you can, and also look at adding the acetyl L-carnitine.
Okay, but you have, in your family practice, you don't have any experience with the LDN and the thyroid itself.
Yeah, no, I don't actually do family practice. We only do cancer treatment.
Oh, I'm sorry. Okay.
Yeah.
It was Dr. B. Berkman? Berkson, yes. And he did a lot of work with alpha-lipoic acid, especially with liver disease.
Right.
Is that where you got your start? Is that where you got your impetus of using the product, or?
Yes, that was one of the studies that we looked at way back, because Berkson published treatment of hepatitis. He published treatment of mushroom poisoning, as well as cancer
And snakebite.
And with lipoic acid.
Yeah. In fact, it was interesting because his early research at the Cleveland Clinic, he was using it IV. I shouldn't say research, his early treatments.
Right.
Because that's one of the reasons he lost his job there, was he was using alpha-lipoic acid IV. And I talked to him at the conference in Chicago in 2013, and he said that oral alpha-lipoic acid was quite beneficial for all these conditions.
Yes, it is. And, as you mentioned, he lost his job. The reason he lost his job was because he was using a natural product which cost next to nothing to treat people in liver failure. He actually saved patients, didn't need a liver transplant anymore, so the hospital was angry at him for taking them off the list.
It was pretty, rather ironic.
Yeah.
Joanne, did you have any other questions regarding low-dose naltrexone?
What would the dosage be on the alpha-lipoic acid?
Oh, alpha-lipoic acid?
Correct. And for the
Dr. Khan?
It can lower blood sugar rather dramatically.
Question. If drugs and surgery are not your first choice, okay, like Tomas, would you say drugs and surgery is your first choice?
No.
All right, you work in a hospital and you see other people who've made drugs and surgery their first choice. How's it working for them?
Not too well.
Of course it is. It's science. Just don't be so down. Irene, what if drugs or surgery, would that be your choice?
No, not at all.
Well, no, we've got these wonderful little laparoscopic, and we've got the drugs a little where they're making them smaller, and the government might help, pay for it. No?
Yeah, but they don't work long time.
Oh.
Long term.
So you have to just keep taking them. Why do you have to keep taking a drug?
Because effects wear off, and they say like one every 4 hours.
But what makes the effects? Do you think that pill sitting in a bottle, the effects wear off? No. Maybe in 40 or 50 years, 100 years. Why, when you put that pill, you place that pill in your tum-tum, why do the effects of that pill go away really quick? Because
body is not used to it?
No, your body destroys it.
Oh.
See, your body's recognition of the drug is that it's bad, that it's evil, that it's toxic, that it's dangerous. And so you place that little pill in your mouth, your body dispatches it. It jumps on it. And the point is, if drugs and surgery are not your first choice, then what is? What would be your first choice? What would be your next choice? If you don't want the surgery, you don't want the drugs, then what would be your choice? Most people are found clueless at that point. So I want to touch base on that today. If you were wanting to get healthy and remain healthy, then what would be your first steps? I don't know. And then later on, we're going to go to the mailbag and answer some of your questions here at Health Quest. But if you were wanting to get healthy and remain healthy, some steps you would take. One, you'd have to change your orientation. I'm not saying use the third bathroom now. I'm saying.
Okay, that one was pretty funny.
Oh no.